With non-muscle invasive bladder cancer, the rates of recurrence for those that have intermediate or high-risk disease affecting just the lining of the bladder, non-muscle invasive bladder cancer, can be very high, approaching 60% over the coming 3 or so years. There was some evidence that by having better visualization using photodynamic assessments of the bladder, we can get better clearance of tumors and therefore less likely to see recurrence occur, which is thought to occur partly because of incomplete resections or missed lesions. Although the evidence base for that was growing, there were some data that suggested that this signal might not be so pronounced in routine day-to-day clinical practice. It may be that if you use standard approaches to managing bladder cancer, which include chemotherapy washes to the bladder immediately after resection, additional chemotherapies or BCG treatment, which are known to reduce recurrence, that might essentially mask some of the effects that were being reported in the literature. The NIHR, major funder in the UK, put out a commission call to undertake a study in a pragmatic setting. So this is a study of effectiveness more than efficacy. And with that in mind, what we designed was a more day-to-day type of study, taking into account the ways that we would imagine the technologies being used in routine practice. That means we had inclusion criteria that were generalizable, and we also had up-to-date management protocols, including the addition of chemotherapies and BCG into the bladder as advised by guidelines. So this study was, I think, one of the biggest contemporary real-life assessments of the technology.